World Health Organization says the threat of a pandemic due to the coronavirus has become very real. Joining us right now to tell us more about this is WHO Philippines Country Representative Dr. Rabindra Abeyasinghe. Dr. Rabi, welcome back to New Day. Okay, we have lots of questions for you. Now, yesterday we jumped from 10 confirmed cases to 24. How do we explain the increase of cases here in the Philippines?
So when you detect a case, the protocol is that close contacts need to be tested for possible infection. As you are aware, we've confirmed 10 cases. 3 of them were earlier confirmed, and more recently 7 others were confirmed. As the Department of Health starts contact tracing among those 7 people, you start finding other people who've been infected. And so it's only natural that you're going to see more confirmed cases coming from those clusters. This is really important that the DOH does the identification of the contacts. And let me explain a little later what a contact means, because many people get worried that they are a contact. But it's important that those contacts are identified, their histories taken and tested if necessary. And when you do this, you can define what we call a cluster of cases. And by doing that, you can prevent the further spread. So who is actually a contact? We talk of contacts who have had very close contact. So being a family member, being a classmate, being a workmate, but spending time in very close proximity. So we're talking a distance of 1 meter or so. So if you've traveled with somebody who's been tested positive, or you've been living with somebody or working with somebody and being very close to them, then you would be considered a contact. If you were in the same mall, you're not a contact.
Okay.
Right?
All right.
So if you were in the same gym, you're probably not a contact. We need to rationalize this, because many people become anxious when they hear that somebody who was in mall X has tested positive. Everybody who went to the mall on that day wants to be tested. That is not rational.
Okay, so we're only testing people who have had close contact.
Exactly.
Does the country have enough testing kits?
So as it was mentioned yesterday, we have 4,500 kits at this point of time. Other tests are being delivered as I talk. They are expanding the testing capacity in the country. Right now, it's limited to the Research Institute for Tropical Medicine, the RITM. The plan is that it will be expanded to 6 other laboratories. The method of testing is now limited to PCR-based testing. There's a lot of research going into finding a point-of-care test, which will simplify the testing. But this is a new disease. We're still learning a lot about it.
Right. Now, it seems that kids aren't getting affected by the coronavirus. Most of the patients are adults. Is this an accurate observation?
This is correct. This is based on observations. We have now more than 110,000 confirmed cases. And if you look at the numbers, it's largely adults. About 60 to 70% are adults over 60 years of age. Very few cases among kids.
So why is
Let
that?
me explain to you why that is. Because about 80% of people infected with the disease have very mild disease. And what is known is that many kids would not have severe signs and symptoms. So the danger is that kids could still serve as a vehicle to transfer the virus from a person who is sick to a person who is not sick.
Right. So, they could pass it on to their parents, grandparents,
Exactly.
teachers who would be more susceptible to manifesting the symptoms. So it's a good decision to call off classes in Metro Manila, you think, because of what you just said?
It's a measure that has been taken after weighing the risks with the hope that it is going to slow down the spread. It was a decision that was taken after a lot of thought and discussion, because there's so many cases that need to be identified and their contacts traced. And weighing the options available, the government decided that it would give the response a bit more time by closing down the schools for a week.
Right. Now, another concern of ordinary citizens is how long can the virus live on surfaces like this table, on a banister, on an elevator button?
On usual surfaces, it's a matter of hours, so 4 to 5 hours.
Okay.
Exceptionally, there's some reports coming out that on metal surfaces indoors, it could survive for a few days. But the virus gets there because people cough or sneeze and the virus is contained in the droplets. That's why we're urging people to practice cough etiquette. Use a mask if you're having a respiratory infection so that you prevent contamination of all those surfaces.
All right. Now, regarding the contact tracing, does the Philippines have the capacity to be able to contact all the necessary people who did come in close contact with a patient?
That's also part of why the proclamation of emergency as a public health emergency was declared by the president. It facilitates and capacitates the local government systems to mobilize additional resources, mobilize people from unaffected areas and provinces so that you augment the capacity in areas that are affected so that efficient contact tracing can be done rapidly. And we have been urging the government to do that so that quick identification of contacts and defining of clusters can be done.
All right. Yesterday, Dr. Rabi, I did feel that there was an increased sense of panic in the country. We saw pictures on social media of people, of empty shelves cleared of alcohol and basic necessities. Is there a reason for us to panic just because the numbers doubled yesterday?
Unfortunately, we've seen this happening in many other locations as well. We've been arguing that panic and unnecessary anxiety is not helpful. We need to base our actions on evidence. And the evidence says just do frequent hand washing, practice cough etiquette, and social distancing. That's far more helpful than stocking up everything.
All right. I guess we can't emphasize that enough, Dr. Rabi. Thank you again.